Hello friends, welcome back to yet another video on Dr. Stocks. Friends, after first round of counseling, my inbox is bombarded with lot of questions. So in this video, I will try to help all of you and I will tell the difference between MD from a government institute, MD from a private institute or DNB. So in this video, I will try to clear all your doubts. So without further wasting time, let's continue. So friends, first of all, congratulations on your allotments. And friends, after first round of counseling, many students are asking me, sir, whether we should go for DNB or whether we should go for MD from a private institutes. These are the most common questions which people are asking. And another question which people are asking, that whether they should go for peripheral MD versus good DNB institutes. First of all, we will answer this question, that whether you should go for peripheral MD or you should go for good DNB institutes. So friends, answer will be different for both surgical and non-surgical branches. So first of all, I will talk about non-surgical branches. Friends, let me tell you one thing, that in non-surgical branches like medicine, pediatrics, respiratory medicine and radio and dermatology, hands-on training is required, but it is not that much important as compared to the surgical branches. So friends, if you are getting good DNB institutes, for example, you are getting Delhi NCR institutes, or you are getting Mumbai institutes, or you are getting Kolkata institutes, or very good institutes, then you can consider DNB institutes in these branches. So friends, and if you are getting MD from a peripheral institute in these branches, for example, a very new medical college in which there are very less number of faculties and very less exposure is there, then definitely you should consider DNB from good institutes. And friends, when I will consider surgical branches in the similar scenario, then I will ask you to think twice before choosing DNB in surgical branches. Because friends, in most of the corporate institutes, there are very less hands-on as compared to the government institutes. And in government institutes, you will get lots of patient load and lots of hands-on, and that is really very must in surgical branches like general surgery, obs gynae, orthopedics and many more. I think this is really very important point in considering your choices among MD and DNB. And friends, there is one more thing. In DNB also, there are some institutes like St. Stephen's or Hindu Rao DDU and B.R. Ambedkar and some charitable institutes in which hands-on are really good in surgical branches also. So if you are getting top DNB, government or charitable institutes, then even in the surgical branches you can consider that. But friends, orthopedics is an exception. Yes friends, even if you are getting top colleges in orthopedics, you should consider taking them twice, because passing percentages in orthopedics is not really good. So friends, for branch like orthopedics, I will still say that you should prefer MD over DNB. And friends, second important question which everyone is asking me is that whether they should go for MD from a private institute or DNB from a good institute or average institute. And friends, again, answer is different for surgical branches and non-surgical branches. As I already told you that in surgical branches, hands-on and clinical exposure matters most, and passing percentage is also an issue. So friends, if you are getting DNB from an institute in which there is ample amount of hands-on and ample amount of surgical training, then you can consider surgical branch from a DNB institute. One thing you should consider is the passing percentage. For example, in orthopedics, if you are having enough money or if you can afford a private seat, then you should go for a good MD private institute, because passing percentages of some branches are not really good, and orthopedics is among one of them. If you can afford and you are getting MD from a good private institute in which there are lot of government patients and lot of exposure is there and good teaching is there, then you can consider MD private over DNB. In these scenarios, money is an issue. Some medicos might not have that much of money, so that is personal choice. But I would like to say that if you can save your money and you are thinking about medicinal branches and getting DNB from average or good institutes, then you can consider taking DNB. But scenario is totally different for the surgical branches. In surgical branches, if you are getting more exposure and more hands-on in a MD institute, then you should go for MD institute. And I think if you are having money, then don't think twice before investing your money in your PG training, because friends, return on investment will be really good. And friends, from this return on investment term, there is one important thing which I want to tell you all, and there is one promise which I want you all to do with yourself, that you all will start investing from your first stipend you will get. Yes friends, and I think it's really important and it's a need of an hour that all medical professionals or all other professionals should start investing in the stock markets. And friends, if you are worried about how to start investing and how to start all these things, as you all know that all medicals are really very busy and they do not get any time. So friends, this is my promise that I will teach you all how to do it, and I will teach you all the basics. I will start a video series lecture on the stock markets. So friends, be rest assured that you will be financially secured. So friends, if you like these videos and if you are liking my ideas, then please like, subscribe and share this channel among the fellow medicos. I will keep making videos and keep helping you in choosing the right branch and right career for you. And friends, if you are having any doubts, then please write it in the comment box. I will clear all the doubts. Meanwhile, as you all know that I am also doing DM endocrinology residency and I am in first year, so that's why I am also busy. So whenever I will get time, I will reply all the queries. So friends, I will see you in the next video. Till then, myself Dr. Nishant signing off. Stay blessed.